Good morning, everyone. Whenever the word cancer strikes us, the first thing which we are bothered about is going through the pain and suffering. Now, what type of pain and suffering is truly major hurdle in the life cycle of a patient? If we try to analyze, it is not the pain of the surgical scar. Neither is it the suffering while going through chemotherapy or that stomatitis which is caused by radiation. I think a major part of pain and suffering is the change in behavior of our near and dear ones. In fact, yesterday, going through my outpatient clinic, one of my patients, early stage cervical cancer, already undergone surgery, and now she's absolutely fine. She's around 65 years old, post-surgery, no major morbidities. Because it was a robotic surgery, there was no concern as far as pain is concerned, and it was her first follow-up when she came to see me yesterday. I was expecting that she would say, I'm absolutely normal, I'm back to my routine, taking care of my day-to-day activities at the age of 65, obviously spending time with my grandchildren and with my peers and friends and family. But somehow when I noticed her, the grin on her face was hiding some pain behind. When I made her talk, actually, I said, what is it you're going through? Because everything is fine now. Your disease is absolutely as good as curable. She said, sir, what is the probability of me passing on this cancer to my near and dear ones? Which I said, absolutely zero. In fact, on a lighter note, I said, had cancer spread like this, then probably we would not be sitting in front of you. We would be somewhere pasted on a photograph on some wall. And then she said, my major trouble has started after I went back home, because my daughter-in-laws have ensured that my grandchildren do not sit with me and eat from my plate. My clothes, my towel, my saris are now not washed in common. They are kept aside and they are washed separately. I think, friend, that pain is far more than the pain which a patient goes through when it is surgery or chemo or any form of treatment. This pain honestly does not get relieved with any tablet or pill or an injection. It is for the society to understand that a patient of cancer does not necessarily remain a cancer patient for the rest of the life. There are more warriors, there are more patients who have gone through the complete healing process. But the society and the stigma continues to make them patient and make them live as patients for the rest of their life. For those daughter-in-laws, a simple, humble question from my side would be, if you go through cancer, how would you feel if your kids try and start keeping a distance from you? In spite of the fact that we are well aware that cancer is not a contagious disease, it does not spread by eating in the same plate or by washing your clothes in one common pool of water or maybe the washing machine. It does not spread by holding hands, by hugging each other. So time has come that let us spread this awareness that a patient, more than the tablets, a patient needs your care. They don't need your sympathy. Let me be very clear over here. A patient does not need your sympathy. He needs that caring touch, that feeling in your eyes that don't worry, you are loved and we are there with you during this battle of cancer. If we can understand this, then probably all other types of pain and suffering which are there can be very easily taken care of with modern medical science. It is not like earlier where a patient has to go through intense pain. We have such wonderful medications available in the form of tablets, in the form of skin patches, in the form of injections. And thanks to our pain consultant colleagues, now giving blocks to relieve pain is now a new norm, I would put it. It is not a new therapy, it is an age-old therapy, but now definitely it is being practiced more frequently. Every patient should go through some yoga or self-healing exercises. You can call it as meditation, you can call it as pranayam, whatever it is. Engage in some form of relaxation exercises. For someone, this relaxation exercise can be bird watching, it can be singing, it can be reading, it can be painting. Engage yourself. Don't let yourself go through that narrow path where you feel whether there is going to be light at the end of the tunnel. There is definitely light at the end of the tunnel if you feel and if you have that grit, if you have that determination that you are going to pass through this narrow stretch of time which you have destined to go through. Because and in the years to come, cancer definitely, as we know, is increasing in incidence, and there are more and more cancer patients who are going through treatment successfully. It is no longer considered as an incurable disease. Chronic disease is what we call it. So friends, I think this is an appeal to each one of you. Those who do not have a cancer patient in your family, well, thank the Almighty, but at the same time, stretch your hand to someone who is in need for that support at this point of time. Have a great day ahead. Good day.